on that. Karen, why don't you introduce yourself as well?
Yeah.
Okay. So my name is Karen Amaya, and I'm a senior right now, and I'm currently pursuing the DPD track, and I would love to do community nutrition in the future. I really like the idea of educating, and I would love to work with children. So yeah.
Gotcha. And Maria, why don't you introduce yourself as well?
Yeah. Yes. I'm a senior right now in the dietetics and nutrition major. I'm gonna graduate now in December. And after I want to pursue my master's in occupational therapy. Um, this is something that came out very recently in my ideas. I want to see how they can go together and see where it goes. Right now, I'm
Okay.
still undecided. I still haven't decided yet what I want to focus on. Depending
Yeah.
on how I see in my master's how it goes, I will decide from there.
Yeah, nice. Very nice. So OT and community nutrition and peds. Very good. Okay, well, wonderful. Thanks for letting me know. So back to your question
Hmm.
about how I think what I remember is I've always, ever since I was a child, always had an interest in food and nutrition because my parents, I think especially my father, was always making these crazy shakes in the morning, and I was trying to understand. And so I just had an early interest early in life, and I actually didn't know you can major in nutrition. I graduated high school in 1987, and I was unaware that one could major in nutrition. I don't even think I knew that there was such a thing as a registered dietitian. It wasn't prevalent. And I knew that you could be a nurse. I knew that you could be a doctor. I knew that you could be some type of
Hmm.
technician, but I don't think that I even knew back then about an RD. And I ended up transferring over to Rutgers University, which is the State University of New Jersey. And I was shocked when I found out that you can major in food and nutrition. I didn't even know this was such a thing. And I thought, just you major in biology or something like this. So I thought it was really interesting. So I majored in it. I was going to be a business major because that's what my
Hmm.
dad was, and I was just going to be a business major. And then I found out that the school offered a degree, and so I switched over right away. And I learned pretty quickly about the career, about being an RD. And believe it or not, I ended up being, as a student, a student counselor, and I ended up guiding a lot of students um, as a student counselor, as an assistant to the counselors for career counseling, because I learned pretty quickly about the field, and so that's what I remember. And then as far as how it expanded, well, that's a lot.
Hmm.
I think it just one thing led to another. But the important message, I think, as it relates to you ladies, is you're going to get back what you put out there. If you don't really express an interest or show an interest or take any type of interest in your classes or your professors or your employers, they're not really going to take an interest in you. Um, Everybody will be nice and be cordial, but you're not going to really stand out. And so what I did was I was constantly talking to my professors, constantly asking them for opportunities, constantly letting them know I was available. And I got internships, I got mentorships, I got to work as a lab assistant, not because anybody noticed me, but because I was contacting them. You know, I ended up doing so I had a lot of opportunities because I basically went looking for them, not because anybody came up to me. And when I got those opportunities, then I was able to list that on my resume, and that led to another, which led to another. So, like for you ladies, if you're interested in OT, go find an OT. Go and make sure you try to not just one, as many as possible. Or like if you're involved in and interested in community and pediatric nutrition, get out there and you may have already, you want to get out there and find a community nutritionist and what they're doing and try to get a sense of what's a day in the life like for them, so.
Yeah, that is good. Thank you so much for the advice.
Mhm.
Are you
Okay.
guys, as seniors, have you
Mhm.
guys had an opportunity to find somebody, even one person that you can kind of stay, connect with and try to, and out there in in your field?
For me, I haven't connected specifically with a dietitian in the field, but I have experience um, volunteering and like going out there and teaching nutrition to individuals with developmental disabilities or like to children at summer camps. I have experience doing that, like the specific nutrition education aspect of it, but I haven't personally contacted a dietitian specifically in that field, but I do
Yeah,
have experience in that.
gotcha. What
Yeah,
about you?
same for me. Same
Yeah.
for me. I'm right now doing more nutrition education in a library here in the community for older adults. And that has been, I didn't know I was good at it. I think I am. I really enjoy educating them and seeing their reactions when they don't know something and they find out that they actually can change something in their diet.
You probably, both of you ladies know, Karen, I'm not sure if you're bilingual, but you realize that being bilingual is a massive asset. I mean,
Yeah.
you know, don't be shy. Let people know that you're bilingual because I
Yeah.
think, or if you know a third language, use that to your advantage.
Yeah,
Hmm.
definitely. What I work at, I work as right now. I work as a host, and I love that I can speak both languages. Sometimes they come to me in Spanish. Sometimes normally every day is in English, but when they come to me in Spanish, I'm like, oh yeah, I can help you out. Doesn't matter. I'll help you. So I'm very grateful that I speak both
That's
because
great.
that's very helpful.
Yeah, good, good, good.
All right, I have other questions here. I actually have like 10, but I'm gonna make them like around
So why
four.
don't ladies flip flop, right? Why don't you guys flip
Okay.
flop to get full credit, right? Maya, why don't you go next?
Yeah.
Karen,
Karen.
Karen, Karen, why don't you go next?
Okay. So you worked extensively in integrative and functional medicine. How do you feel this approach has transformed the way you view and practice nutrition?
So I'm not sure if you guys had a chance to just look up what functional nutrition is about, but if I could just distill it down into just a couple of words for you, I would say functional nutrition is nothing more than looking for root causes. So the question that students have or new dietitians have is, well, what do you mean? Isn't that what we're all doing? No. Unfortunately, that's not what you learn as an undergrad or as a dietetic student. And let me give you a very specific example, okay? So if you have a patient with diabetes, right? Diabetes is something that dietitians work a lot with. So for example, what you learn is how to do things like carb count to keep their blood sugars controlled. But nobody really teaches you what is the root cause of their diabetes or insulin dysregulation. Can you tell me what, as a senior in college with a 4-year degree in nutrition, what the root cause of that is? Right.
That would
So
be very hard to tell.
right,
Yes.
right, right. So, I mean, it's complicated, but the thing
Yeah.
is, so to answer your question, Karen, I decided that, I was a young dietitian and I was like, I felt like, I'm writing these meal plans, but I don't really feel like I understand the root cause of what's going on. I mean, I'm carb counting. I'm trying to help Mr. Such and such keep his blood sugars regulated. But, I felt like there had to be more to it. I went into this field to try to really understand food and nutrition, and I felt like I understood it on a very cursory level, right? Which means a very basic level. And I just felt like I needed to understand more. And I knew that I was not going to get that from my undergraduate training. So functional nutrition is not about, Eastern medicine, Western medicine. It's not about alternative medicine. It's not about recommending supplements. It's about understanding the root cause. Like another example is, let's say your patient comes to you and they have GI issues. Where do you start? So when you learn about a functional nutrition approach, you learn a very specific method of how to work up the patient using a root cause analysis. And so in some patients, you might find that, this patient just needs to eat more fiber. But you might come to find out in another patient that this patient has an infection, or you might come to find out that in this another situation that maybe this patient has a food sensitivity. All of these things are within your scope of practice. And I think dietitians get confused about scope of practice, which is why I tried to talk a little bit about scope of practice at the very beginning of this course. We talked about it a little bit, not a lot. And we'll talk about it again, maybe a little bit one more time towards the after Thanksgiving. But what I'm saying is that what led me to functional nutrition is that I wanted to really understand the root cause, right? When, Karen, when you're working with a PEDS patient, you're going to have a situation where this little kid's going to have eczema. So what are you going to tell the parents? What are you going to, as far as the diet's concerned? Well, if you understand a food cause perspective, then you might understand like, okay, eczema is an autoimmune skin condition, and the skin is related to the gut. And so you might learn about how to clean up the gut, which then will lead to the skin. Because when you think about it, the gut is just the inner continuum of the skin. It's all related. So a lot of times in patients with like acne or skin disorders, when you clean up the gut, which requires a variety of steps, then all of a sudden the skin clears up, right? Or like maybe behavioral issues and stuff like this. So all I'm saying is that, it was all about trying to understand a root cause. And I wanted to go more than just managing symptoms. I wanted to go deeper. So that's how that all came about.
Thank you so much.
Thank you. Thank you.
Just something to think about as you guys go on into your own fields, depending on how deep you want to go. It may, especially for you, Karen, it may not be that clinical. And, with community nutrition, you don't get that clinical. But, the thing is, it's hard to separate these things out when you get out there into the field and doing community nutrition. The lines are blurred. It's hard to not talk about one. It's all sort of connected,
Perfect. So I have this one. What has been the most rewarding and the most challenging aspect of integrating functional medicine into traditional healthcare settings?
Well, I never worked in a traditional healthcare setting because exactly of what you said. It's too challenging. But I mean, I did for a very short period of time immediately after my internship. I worked part-time in a hospital. I don't even think it was a full year. I can't really remember. It was a long time ago. And it was just to really practice some clinical skills. Yeah. It was right here in the Tampa area. I live here in the Tampa area, and I worked, I think, at one of the Tampa hospitals for a short period of time. Honestly, it was so long ago, I can't even remember. But then what happened was I just decided to do my own private practice. And it wasn't like I got elaborate immediately. It just started off as like a side thing. And I think I really wasn't a functional medicine or functional nutrition dietitian at the time. It was just sort of the basics, the simple stuff. And then little by little, with more training, I tried this, I incorporated this, and then a little bit of that. The next thing you knew, I was ordering some labs, and then which by the way, dietitians can order labs. That's another thing that dietitians don't know they can do, can order labs. And it's not just in the state of Florida. Now it's in every state except New York. You ladies, when you get out there, you'll be able to order labs through big lab companies if that's something you want to do. So, yeah, so let me just think about that. So, yeah, so the challenging, insurance, insurance is getting better, but you're going to find out that if you want to have a private practice and bill insurance, insurance pays poorly, very poorly. And so you're going to have to see a lot of people just to be able to earn a living. So that's why I did just a cash basis. I think a lot of young dietitians don't realize how easy it is to do that and how profitable it is. I remember when we started the class, I was asking the class about being a W-9 versus a W-2, meaning being an employee versus an independent contractor. I was kind of surprised at how many of the students weren't really familiar with the difference or the benefits, which is fine. You guys are still learning, that's fine. But so to answer that question, it was challenging because it's a fairly new model, but today it's becoming more and more prevalent. And so today there are, if you look up, for example, like Fay Nutrition, FAY Nutrition. This is an organization that bills insurance, that hires dietitians, RDs, RDNs to come on board, and they bill insurance, and more insurance is now covering these services. So, but if you want to do it on your own, it may be a little tricky, but if you work with a group, you might be able to. So billing is challenging. But like I said, I ended up just doing a cash business, and you'll be surprised how many people are willing to pay you for your service. The thing that's changing though now is that with AI, you realize that AI can write up a meal plan for the patient. You don't really even need a dietitian. So you have to kind of find creative ways to kind of get your services out there. So, there's
Yeah.
there's change. And so the challenges keep shifting with the technology. The challenges for me from 10, 15 years ago are a little bit different than the challenges that you guys are going to experience. Um, I think the thing that you guys will experience, I'm going to tell you right now, is there's a turf war going on between dietitians and health coaches. Do you know what I mean by that when I say a turf war?
Yeah.
Yeah.
And so the problem is that health coaches get all kinds of training, but it's not within their scope of practice to recommend anything clinical. They might be able to talk about very, very basic general stuff, but they're really not supposed to be doing that, but they're being hired. And the reason they're being hired is because they're cheaper. I mean, think about it. You have to get a bachelor's degree. Now you have to get a master's degree. You have to do your internship and you have to take a board exam to become an RDN, right? So now you're going to go up to an employer, you're going to demand a certain wage for that. And say I'm the employer and some health coach comes up to me and I don't really know better. So the health coach is half the cost. So I hire him or her instead of the RD because they're cheaper. So this is one of the problems that dietitians at my generation are fighting with the academy, basically saying, you guys have now required all these RDs to pay thousands of dollars more for their masters, but where's the work and the money commensurate with the investment that all you young people have to put out there? So
Yeah,
it's a
exactly.
challenge. That's your challenge.
Yeah, we do have to put a lot of work and invest in it too. Alrighty. Karen, you want to do the next question?
You've been recognized for your advocacy in the dietetics field. How do you envision the role of a registered dietitian evolving in the next decade? I guess that kind of goes into the what you were just talking about with
Yeah.
the health coaches. I see a lot of them like on social media, and it sucks sometimes because like my mom will sometimes listen to these health coaches on social media, and like I'll see her doing something or like taking a supplement, and it's I I don't know how to get her to like not listen to these people on social media. But I feel like it's so prevalent, and that's kind of like what we would have to deal with essentially. Like this new uprise in people who think they know what they're talking about.
Yeah. And let me tell you, Karen, to be really brutally honest with you, let's talk about why it's happened.
Mhm.
Because dietitians, you said because dietitians have not done a good job. No, dietitians don't put themselves out there. Dietitians don't are, I mean, I'm talking as a whole, right? Obviously, not
Mhm.
always individuals that do, but dietitians have basically done a poor job putting themselves out there. The academy has done a poor job positioning the dietitian as the expert. Everybody has their own, they have a dentist, you have a doctor, you have an accountant. Who is your dietitian? You don't have one, right? Because it's seen as something that's unnecessary. So your job as the next generation coming in is to really show and your worth, and so instead of worrying about what the health coach is doing and trying to worry about getting your mom not to listen to health coach, my opinion is to tell RDs, worry about what you're doing. What are you doing? let's not worry. The health coach is getting aggressive. She's putting herself out there as an expert, and she's willing to drop the money on her education. But the dietitian has to also put herself out there. And I'm not talking about you specifically or Maria, you specific. I'm just saying in general, right?
Yeah.
So
Yeah.
I think, professionalism, right? I think also a knowledge. For example, if your mom is taking a supplement, you should know about supplements. That's totally within your range. I mean, if it's not the job of this dietitian to know about a supplement, whose job? It's your job. So your job would be to say, okay, mom, you're taking this supplement X, Y, and Z, and let's see why. So because supplements are extremely powerful, they're very helpful, but you have to know when to take them.
Mhm.
Not all, I would say some programs, undergraduate programs teach dietitians about supplements and some don't. So some of you guys get that education and some of you don't. The idea that supplements are just a waste of money is a very, very unfortunate thing to teach dietitians because actually that's not true at all. Supplements are extremely important part of a clinical um, of working someone up clinically, but you have to know what you're doing. You have to know the products, you have to know the contraindications, you have to know the difference between this version versus that version. For example, you have to know the difference between probiotics that, for example, hit the upper GI, the lower GI. What do you take if your patient comes to you and says, hey, I have constipation? What probiotic are you going to recommend her? What probiotic are you going to tell her when she has diarrhea? What probiotic are you going to tell her when it's an upper GI issue? What probiotic are you going to tell her? You have to know this because the health coaches are learning this. They're learning a lot, but the irony is that it's not within their scope of practice to actually put it out there. So I think the problem is the dietitians have to get way more aggressive because otherwise we're going to become dinosaurs and they're going to take over. And it's just so we
Yeah.
have to be honest with ourselves. I think, we're still very, we're still gotta really put yourselves out there. And I think you guys are doing a good job, but as a whole, just as a whole, you know,
It gotta be
Yeah.
more. Gotta be more.
yeah,
Yeah.
yeah, for sure.
All right.
Thank you.
Thank you. And I have a last question here. What advice would you give to inspire aspiring dietitians or healthcare professionals who want to make a lasting impact in the field of nutrition? Well, I think it what you said just now.
Yeah, yeah, yeah.
Yeah.
Well, I mean, I think, ladies, I think first of all, you have to just get honest with yourselves about what it is you really want. What do you want? And then you take it from there, right? I wouldn't say what does your mom want? What does your boyfriend want? What does Dr. Dean want? It's really what do you want? What does Karen want for Karen's life? What does Maria want for Maria? So that's always the first place to start. Um, I will also tell you this. Um, Unfortunately, being a dietitian is not a very lucrative area financially. Um, you're going to find out that community nutrition, Karen, since you were so informal and you use the word sucks, I'm just going to tell you that the pay sucks. Okay. The pay
Yeah.
sucks badly. And this is why I didn't bother doing, working as a W-2 because you're going to be in poverty, period. Unless you are married to someone who's going to bring in a second income. And when I mean poverty, I don't mean necessarily like the bare minimum, but I mean, good luck living in Miami making $40,000 a year,
Yeah.
Mhm.
right? You can't do it. You can, but it's tough. And so I like the idea, Maria, that you're going to go on to do OT. I think that's going to help you. And Karen, if you're going to do community nutrition, I mean, that's fine, but you just don't be shy to ask about the money,
Mhm.
and be open to doing a side thing to make extra money, a side gig as a contractor, where you put yourself out there and you do side jobs because you're going to need it to boost your income. Community nutritionists, I don't even think they're making 40K, honey. Good luck with that. I mean, pediatrics, all of that. I mean, it's now, I'm not saying it's all about the money, but now as a 55-year-old woman looking back, I realize that, you know what? Money does matter.
Yeah.
Okay, if you still have to feed your kids, chances are that, we as women, we're the ones that go on, we have the children. And, we have to just to be brutally honest with you as your, your instructor, as your coach, don't be shy about, asking for money. And if you can't get it from your job, you're going to have to go find other, try to do other creative things. Also, I would absolutely join Facebook groups and see what the other dietitians are talking about and doing. And I can tell you one thing that's big, big, big is dietitians your age are learning about technology. They're learning about getting their websites up, about SEO, about social media. I'm not just talking about posting. I'm talking about using it as a way to generate business, right? So I think this is something that you guys got to try to get more savvy about. Again, not you specifically, I'm saying your
Mhm.
generation. And yeah, because it's a changing landscape and technology is constantly updating. So keep yourselves on top of that if this is the field that you want to go in. I
Yeah, I'll
personally
do
think
that.
that if you that I've had several people come to me and ask me, should I be a dietitian? And I was like, no, I would be a PA. If I could go be a PA because you'll make better money and you're still in the field. It's not easy to be a PA. I think there's a nice PA school down there. And I'm not trying to be, discouraging, but I'm trying to let you know, to be
Yeah.
honest with you, 25 years later from now, if you could give yourself advice, if I could give myself advice, what would it be? And, so
Yes. No, yeah, I understand that completely. I remember when my first class ever at FIU was orientation class for nutrition, and she started disclosing how much we were gonna get, like depending on what we get. Like I know community nutrition, and then also what's the other one? The one that makes technically the most. It's food service. When you go into food service management, I think that's the one that makes the most in the list. Um, the clinical nutrition, and I was like, wow, we have to take so many classes, so many chemistry classes, and all this, and the pay is not what I expected when I
yeah,
when I first saw it. And as you said, it's not all about the money, but money is important.
it is.
So I started as yeah. I'm sorry. Yeah, go
No,
ahead.
no, go ahead, go
Uh,
ahead.
but yeah, that's why I started looking for other options. I was like, well, maybe OT. It's something that I like helping people. I like everything that has to do with people, and it's not a super expensive master's degree. So I was like, let's try here and connect them. I don't know what is gonna come out of that, but that's why I was looking for other options
Yeah.
without leaving nutrition like 100%.